Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast.
Hello, Jess. Glad to see you and talk one of our favorite topics today, skincare.
Oh, yes. Here on the Med Edit, we absolutely love talking about skincare because, as you know, skincare is self-care.
Absolutely. And whether you are having a brat summer or you're staying demure and mindful, to throw in those TikTok trends, we are talking TikTok skincare trends today.
We will be joined for our discussion by social media star Dr. Krystal Massey.
We have so much to talk about. There will not really be a second part to today's episode. It's all skincare, all episode long.
Exciting. Again, today we have Dr. Krystal Massey on today's episode. She is a double board certified dermatologist practicing in Cheyenne, Wyoming. Welcome to the podcast.
Hi, thank you so much for having me, Jessica and Cari.
Now, Krystal, is it still cold there? I'm just curious.
We are not cold yet. It's still sunny and beautiful in Wyoming, though we're dealing with some fires, but we got some rain last night, so we're good.
All right. Well, stay safe. And we are so happy to have you on the podcast today. You take care of kiddos and adults. You also keep your ear to the ground regarding online skincare trends, which honestly is really a full-time job in itself after the research that I just did to prepare for this episode. And I feel like every time you turn around, there's a new trend to try to stay on top of. And I'm still trying to figure out which ones I should try.
It's so true. It really is. And sometimes I feel like I have to keep up because my patients are ahead of the curve and they're asking me about these things all day, every day. And I want to know about them to be able to respond, but it's a full-time job.
Absolutely. I think that you can get down that dark, what we would say, like rabbit hole of just going down these pathways, talking about skincare. And then the overwhelming part is that what is real and what is not. So that's what we're trying to do today is talk to somebody who's, double board certified, who is a dermatologist that is in tune with the TikTok skincare trends, but also can actually break down fact from fiction. So let's jump in because we have a lot of these fun ones to debunk today. But our first trend or topic to discuss from TikTok is talking about sunscreen. And you're thinking, I already know about sunscreen, but there's been a lot of talk about sunscreen on social media lately, and specifically talking about sunscreen saying that it causes skin cancer. So Dr. Massey, tell us what is going on with this trend. Why am I seeing it everywhere? Why are people talking about, I don't do sunscreen anymore?
Yeah, this is really a sad and frankly harmful kind of campaign that's out on social media right now. And the scary thing is, skin cancer rates are on the rise, and it is just, it's a disfiguring disease and sometimes can even be a deadly one as well. And so, I really want to and I think a lot of dermatologists online really want to get ahead of this, but, things go viral and it's hard to put a stop to it. The skin cancer rates we know are increasing. And, I think people for good reason sort of ask, well, we're, all of this stuff about sunscreen and we know all of these things about sunscreen and we're using it more, but why are skin cancer rates going up? I think questioning and some skepticism is a good thing, right? That's science. But we have to look to the data and we have to look to evidence to make sure we're actually answering this in a data-driven and scientific way. And then I think that coupled with just it's viral to be, to talk about toxic and, toxicity. And of course it's, we all question big pharma and all these big companies and some of them have some bad reputations, right? For doing things that are in the name of profit. And so I think all of that put together has sort of become this, tornado of disinformation online. But the good thing is these things have been studied. There are lots of data out there, lots of big retrospective analyses, lots of big meta-analyses that have shown that sunscreen is safe. We have no evidence to suggest that it causes cancer. And probably, the reason for this increase in skin cancer is one, we're living much longer than we used to. And we are spending a lot of time outdoors. And I guess the counter argument is, or one of the actual arguments I think that's reasonable with sunscreen is, okay, is sunscreen allowing us to spend more time outdoors and maybe we're not burning, but we're getting more cumulative sun exposure? Thankfully there are, which is an interesting question, right?
Yeah, that is an interesting point. Mm-hmm.
Yeah, and so there have been these huge, meta-analyses and retrospective analyses that show that that's actually not the case. People who wear sunscreen have no increased risk of cancer despite spending increased amounts of time outdoors. I think we're just getting much better at picking skin cancer up. I think, some skin cancers really don't have, a mortality effect. It's more of a morbidity effect with disfiguring surgery and things like that. So it's not, people 100 years ago could live with a basal cell for 20 years until they died, right? And now we're picking up a lot more. We're able to detect them, and our treatments are, so much better than they used to be. Melanoma treatment is like totally changed over the last 10 years, and survival is getting to be much better. And so a lot of changing in the landscape of skin cancer. But here's the bottom line. Sunscreen does not cause skin cancer or cancer. But we do have a ton of evidence that the sun does cause skin cancer, right? And the things that we know are, benzene is a chemical that has been found as a contaminant in sunscreen and other skincare products and other personal products like aerosolized hairspray and things like that, because it's a breakdown product that occurs. And we know benzene, is a known carcinogen. And so I think this just points to the importance of making sure your expiration dates are, up to date on all of your products. And then I think it also kind of brings into question how safe aerosolized sunscreens are. And, for that reason, I typically just recommend people stick to the old-fashioned pump sprays if you do like a spray.
So let's talk about that a little bit more. You said that the aerosolized sunscreens are maybe not the best choice for both maybe pediatric and adult patients because of the fact that the benzene broken down can come out of more aerosolized and then we can breathe it in, which is the problem. Not necessarily even being necessarily directly on the skin, but more because of breathing it in. Is that the big issue with that one?
I think that a lot of this is sort of to be determined. There was a big study that came out a couple of years ago, actually, from the FDA that showed, sunscreen ingredients are detected at blood levels, right? What we don't know is what the actual clinical effect is of that, right? Lots of things can be measured in the blood after application, after, all of these things, but what is the downstream effect? And to date, we have no evidence that despite these, levels, we have any, meaningful clinical, effect.
So I assume that's where that probably came from then, that the idea that it maybe caused cancers, because someone says,
Right.
okay, if you can detect it in the blood, then it must, and the rise of skin cancer can be seen. There's the data there. There's the rise of skin cancer. And now the FDA put out that they can detect it in the blood. We talk all the time about, relationships are not, it's not always causal, right? Just because that there is a relationship there doesn't mean that it's caused by the other thing that we're looking at. So maybe that's boiling down to where some of that came from a little bit as well. I think that's an interesting point, especially when we're talking about choices in sunscreen. I have we both do, a good dermatologist friend who she sends out her versions of what her best kids sunscreens are as a gift. I think she gave it to my kiddo for their third birthday party. She's like, and here's my favorite kid sunscreen.
Yeah. She also gives it out as party favors.
Oh, his party. It's a great one. Party favors.
That's my favorite baby shower gift, is I just give them like all the skincare that you need for your babies. But yeah, so I think picking, if you still want to be mindful about sunscreen, because of course there are so many things that we don't know, I think probably the safest bet is going to be a mineral-based one, zinc oxide, titanium dioxide. They sit on the top layer of the skin and act as just a physical barrier between the sun and your skin, rather than, being absorbed in any way. And then making sure you're doing a lotion, a cream, or a spray pump, and then rubbing it in. I think, if you really, really, really want to be super careful and be mindful, I think that's probably the gold standard. But that being said, chemical sunscreens are safe. And if that's what you have access to, and or if that's what you're actually going to wear because it doesn't leave a white cast, or if you're actually going to, you have to have it in a spray because that's the only way you're going to get your husband to wear it, it's still better than nothing, right? Because what we do know is a lack of sun protection leads to skin cancer.
Absolutely. One of the helpful tips that I saw somebody doing with their kid at the pool, putting on a sunscreen that's thick and white like that on their kiddo, is that they take one of their makeup brushes and leave it in the bag and then use one of those thick foundation makeup brushes just to put it all over there and then just wash it. I guess you can throw it in even the washing machine, in a little bag, and it can wash them out real quickly. But it's just something to put on the kid's face. That way you're not just using your hands, squishing it all over their face, trying to get that sunscreen on them. So just a tip I saw from the pool the other day.
Love it. Yeah. We all know we're chasing them around trying to spray them when they want to run into the pool, right?
Right.
So whatever tricks we can get.
Absolutely.
That also just highlights, sun protection doesn't just stop with sunscreen, right? Another way to be mindful is just, sun protective clothing, not being outdoors, in the heat of the day between 10 and 2. I love the sun shirts, the hats, you can get so many other things just to help so you're not having to reapply so frequently. You're not having to use as much. You're not having to chase your littles around. There's just a lot more than just, sunscreen.
And I think whenever we talk to dermatologists, they say, what is the best thing you could possibly do for anti-aging for your skin? And they say sunscreen. I feel like people kind of tune that out and think, okay, well, I want something right now. Well, we'll talk about TikTok trends for things right now, but really that's why we started this episode off, is talking about sunscreen, because if the risk of cancer doesn't get you, then maybe the risk of wrinkles is going to be what convinces you to put some sunscreen on, and the risk of having older looking skin and hands and, arms and everything else. I mean, you can see a very different look to a lot of different people when they get in their, 40s, 50s, and 60s, is depending on their sun exposure. And you can look at some person and be like, wow, why is their skin porcelain white and fair and there's just not a single wrinkle? And they're going to tell you they either probably never go on the side in the sun and also use that sunscreen religiously. But so let's go on to the next trend. Cari had to fill me in on this one because I had absolutely no idea. But castor oil for skincare. We have seen it mixed with frankincense oil for under the eyes. It's also been mixed with Vanicream as a facial moisturizer. Thoughts on this, Dr. Massey?
This was new for me too. I had to look this up. But I will say I'm here to report, I think it's actually a thing. Castor oil has been used for centuries in Persian medicine and maybe Dr. Sorrell, you know about this, as a laxative.
Yeah.
Yeah. Okay. And also as a smooth muscle contractant. So beware though with this, because it can induce labor, apparently, probably more likely with ingestion. But of course, we always want to be careful even with things applied to the skin. But it's mostly made up of fatty acids, which are great for the skin. But it sounds like it's been reported to have antimicrobial, anti-inflammatory, even analgesic effects. So it can help with pain reduction, antioxidants, these are all the buzzwords, right, that we want in skincare. And then also there's an enzyme called tyrosinase that basically makes pigment in your skin. So it blocks that, which is, great for dark spots, dark circles. So I specifically came across a study used for dark circles around the eyes, and it showed significant improvement in that. And then there was another big study in the ophthalmology literature, not big, but there was another study in the ophthalmology literature using it for blepharitis and sort of ocular rosacea symptoms, like, that gritty foreign body sensation in your eye, getting styes all the time, things like that. And it was very beneficial for that. So safe to use around the eyes, which is kind of nice.
I love that. That's a fun one. I have not heard of that one before, so I definitely think that's a fun one to add in.
Yeah. And what do you think about adding the frankincense into that? Do you think it adds anything to it, or is it mostly just the castor oil?
Yeah. So I also had to look this up. Frankincense has been reported, actually, going back to our previous topic of skin cancer, it's actually been reported to help with basal cell skin cancers. Big reviews have not shown actual benefit, but there have been smaller kind of case reports. So that was really the only thing that I had heard of with frankincense. So sort of dug some digging in on this for you as well. And interestingly, might also be a thing. You might want to mix it in. There was one study in mice that compared it to the absolute gold standard in anti-aging, and that's vitamin A. And in this small study, it had superior anti-aging effects. So I think this may be something on the rise.
Interesting. Very interesting. Well, I guess I'm going to have to go back and click that link that somebody put in their TikTok profile on getting me some castor oil and frankincense. And like you said, it's always kind of hard too, because the theory behind the science may be there, but sometimes how it's applied, distributed, packaged, all of those things can actually affect how effective it is. But, now after researching all of this, my whole For You page is now TikTok skincare trends. So one of the ones that keeps popping up, which I find very interesting just because of how long it's been around for, is the antibacterial face wash trend. And there's been some fancier brands that people reference on these videos, but honestly, the one that comes back a lot is Dial. And it's one I've been seeing referenced the most. So what are the thoughts on this?
So this is not a new concept, right? We know bacteria, plays a major causative role in a lot of skin diseases. Acne, for one, there's a bacteria called P. acnes that we know contributes to inflammatory acne. Eczema is another one. Staph is implicated in, eczema flare-ups and things like that. We treat lots of skin conditions with antibacterial things, antibiotics, topical antibiotics, oral antibiotics. And one of the main topicals that we do but recommend for acne is a benzoyl peroxide, is a huge ingredient in dermatology, and is antibacterial and anti-inflammatory. So I think this is definitely true. The real balance here is, the fact that it's a soap, right? So soaps are a little bit different than cleansers. The mechanism of action of a soap, right, is the same when you're cleaning a greasy pan, right? It's removing all of those oils and greases from the pan. The problem is what allows our skin to be a great barrier is this lipid bilayer that we have, and that's chock full of cholesterol and all sorts of fatty acids and things like that. So if we use a soap, it's sort of stripping all of that away and removing the ability of our skin to be a good barrier. Once you get into that cycle, you're putting your skin at risk for more bacterial infections, for more inflammation, for more irritation. And it sort of gets into this vicious cycle that, I struggle a lot with my acne patients. All my acne treatments are kind of irritating and drying. And so we're always sort of having this push and pull, trying to make sure we're not, removing the barrier while we're treating. So I think that's sort of the main thing. So I wouldn't recommend doing an antibacterial soap every single day with every wash, but making sure you're sort of monitoring really closely for, signs of irritation and dryness, and switching on and off with just a gentle cleanser, and making sure you're really good with your moisturizer.
So basically you can go overboard with it. I think I've personally done that. I'll use my glycolic acid wash. Like I was using it every single night, including, in addition to my Retin-A and everything else. And you just ate away at the layer of that skin. So
yeah.
I've gone to, there's a great one that has like a triple lipid repair cream that you can put on at night. Love that stuff. So I think spacing it out, you can almost do too much to get too aggressive with it.
I will say the one thing I liked about this though is that I felt like it was one of the few things I saw where they weren't trying to sell you something, right? I mean, because like Dial's, and all things considered for skincare comparison, pretty cheap, very widely available. You can get it anywhere. So that's kind of the only thing that really caught my attention about it. I was like, wow, if it is something that's helpful, it's something that most people can have access to without spending a lot of money.
Well, and benzoyl peroxide is the same way. It's very inexpensive. I prescribe it or, recommend it all the time to my patients. We'll do, a clindamycin, which is an antibiotic topical cream that they want us to pair with the benzoyl peroxide because you need that antibacterial wash with it, and works really well. But you're right. It doesn't have to be so expensive. You don't have to buy all these products that some of the skincare influencers are getting a kickback on just by talking about it.
100%.
So yeah, dial may be a next option. Maybe just make sure it's not the same dial that you're washing the other parts of your body with and then putting it on your face. You just have a special one set aside just for the face.
Yeah, not every day, maybe.
Yeah. So the next topic that we're going to talk about is actually a really fun one because we're talking about hypochlorous acid spray for acne, rosacea, or perioral dermatitis. I actually saw this, and I do not stay up on the TikTok trends, I'll be honest. But this is one I did see and was really curious because it was being marketed to using after you exercise and work out. I work out real early in the morning, and then I am scrambling usually to get my kids dressed when I get back home, get ready to go to work, get changed. And sometimes I don't have a chance to really like deep wash my face after a workout. And so they had suggested spraying it on your face after a workout before you went and did your next thing. Did I just get sucked into a TikTok trend for no reason, or is there evidence to this?
No, there's totally evidence to this. And yeah, hypochlorous acid is just having a big moment right now in skincare. And, there are some trendy brands on social media, but there are also super cheap alternatives on Amazon for, double the volume, half the price that I recommend to patients all the time. This same story as, what we just talked about with the antibacterial effects, hypochlorous acid, how I describe it to patients is sort of like a swimming pool. It's like chlorinated water almost.
It smells like it too.
Yes, it smells like it. And, we've been recommending dilute bleach baths for our eczema patients for a long time. And we used to do it because of the antibacterial effects, mainly because we thought, okay, eczema patients have higher rates of staph on their skin. And when we reduce that staph load, their eczema gets better. But actually, studies in mice have shown that it's anti-inflammatory as well. It sort of targets that NF-kappa beta pathway. And so it kind of is a dual action. But parents tell me they're always super freaked out when I first tell them about put your kid in a dilute bleach bath. Like, this lady is out of her mind. But I always explain it's the same concentration as a chlorinated swimming pool, or very similar, just minus like urine and all the other things that are in the swimming pool.
Hopefully.
Right? Try not to think about it. But they come back and see me and they're like, oh my gosh, the nights that we do these dilute bleach baths, they're so much less itchy. It's so soothing. They sleep better. And I'm having to use less topical steroids. So that's sort of where it came from. But, like we talked about, acne, perioral dermatitis, it's sort of this like, worsened by bacteria, but also inflammation. And it's just a really nice combo. And so I typically have my patients with, struggling with inflammatory skin diseases on the face buy one of these sprays. It's super easy. Just spray on right after you cleanse. Just apply your moisturizer or any of your products right after, and can be just a really nice, helpful adjunct. And but yeah, after workouts is great too. If you're stinky, smelly, you can do in the armpits as well, which is nice. I have my hidradenitis patients, a condition where you have lots of boils and abscesses recurrently in the intertriginous areas. I have them use it as well.
Oh, I should prescribe that for my patients. That's a good idea. I love
Yeah.
that.
Yeah. There's there's one on Amazon called Skin Smart. It's a big, nice big jar, and is much cheaper than some of the brands you might see on TikTok. But I use that one personally.
That's awesome. Okay.
Awesome.
Love that. So maybe I didn't get sucked into something without any total evidence. Even doctors, we sit there like, oh, I should try that out.
Right. Like you said, it's a reason it's $1 billion industry, because
Absolutely.
we care and about our skin, and probably sometimes more than the rest of our body,
Right.
to keep looking good. So, we'll add to cart.
Yes.
Well, this next skincare, I don't even know if I'd call it a trend. I mean, this is just kind of, I feel like Korean skincare has become like the gold standard, the skincare Bible that people are following. And honestly, like, it seems to work. I just don't know what to do with it. Now, what are your thoughts about sleeping or even just wearing these viral Korean collagen face masks that I keep saying for this quote unquote glass skin trend, that we will talk a lot about more in just a minute, but specifically just the face mask that I'm seeing?
Yeah, good question. I have been seeing it a lot online as well. I haven't tried it personally. I cannot sleep with something on my face. Like, I don't know, that seems a bit odd, or difficult to do. I have enough, difficulty sleeping at night, but I think the masks in general, just from an environmental perspective, I don't love. I think a lot of times in the masks, they add a ton of just added things like fragrance and preservatives and things like that, you may not need. So I really don't love recommending face masks to patients. That being said, I think once in a while, if it feels good, self-care, if it feels good, then do it. But it's not something I would do every night necessarily. And that viral one that you're bringing up, I looked up the ingredients. It does have fragrance. It's got rose water in it, and then a couple other potential allergens that people may have. So not necessarily something I'd recommend for eczema prone or sensitive skin. But, once in a while, I think fine.
So good to know too is that some of these trends may actually have opposite effects. And so you may be sitting here, I'm more of an acne prone skin person. And so you're sitting there trying so hard if your skin's broken out to do everything you can to get it clear. And it's just not getting clear. And you may say, well, I just need more. I need more. I need more. Well, that could be probably the problem is that we need to go back to the basics. We need to really go back to basics, and good things take time. It's not going to be, I tried out this, trend or this recommendation from maybe even from the dermatologist, and then my skin didn't clear the next day. Well, it's got to take time. And sometimes that time is a couple months, but adding in continuous things that you've seen on TikTok might be more of a problem or create bigger issues like an allergen.
Yes, totally. It's so frustrating. I feel for my patients sometimes. I have even these young girls that come in with, all of these products that they're using, and, they're teenagers and they're breaking out, and they've been, trying everything on TikTok. And it's sad because they've been doing it for so long, waiting for that benefit, and it's just not there. And now they have more problems like scarring or, post-inflammatory hyperpigmentation and all of this. So I think, if you're struggling with a medical skin condition like acne, it's a great time to see a dermatologist up front before, all of these kind of negative sequelae can happen. But yes, less is more, 100%.
Absolutely. And I think from what I saw for the effects of it, it mostly seemed like it was just very hydrating more than
Yes.
anything, which I think you could probably get results from a different type of product. Not necessarily having to use that one because the glass skin really, which we'll talk about in just a second, a lot of it's just the hydration more than anything. So it's topical hydration. And speaking of glass skin trend, and I know I'm leaving some stuff out because I watch these regimens and there's a lot, but kind of the most common components that I saw were, first of all, something they call the double cleanse. So first it's like a cleansing oil. And there are some specific brands they referenced on there, but then specifically followed by a cleansing foam. So I honestly, I would say, I don't think I've ever done that. So is that helpful?
I think it can be. I think if you're really you have really oily type skin, or you're wearing a lot of makeup, a regular water-based or a foaming, water-based cleanser may not be removing all of those oil-based products. So, people who wear lots of makeup, or if you are oily prone, then I think starting with an oil-based cleanser, just to remove that first, followed by, a water-based or a foaming type cleanser just to kind of get rid of the rest of the sweat and the debris. I think that's great. But if you're not a big makeup wearer, or you're not super oily, or even if you run more on the dry side with sensitive or, eczema prone skin, then I don't think a double cleanse is good for you.
Interesting. Okay. And one of the other things that they kind of followed it with was rice milk toner, specifically either in liquid form or in toner pad form. And I know we're going to mention that in a second. Then just lastly, I'm going to say this wrong, but centella acetica comes up a lot. I'm sorry for butchering that. And I'm not sure if you've heard any of these, but between kind of the milk toners and that other ingredient that I just butchered, what are your thoughts on these?
Yeah, I have heard of them. And I guess just as a broad statement for the Korean skincare in general, we talked a little bit about this earlier. This is a little bit of a data, black hole. There's not a ton of big studies out there. That being said, for people who love kind of playing with different skincare, ingredients, and who find joy in all of this, I think it's great to try, right? But I have a ton of patients who come in to see me also who are like, I'm so overwhelmed. There's so many different things online. I don't know where to start. I've ordered all these things. I have a medicine cabinet full of them. I don't know what to use, so I'm just using nothing. I think if you're looking to just be, a minimalist and just stick to the basics, then Korean skincare probably, or any TikTok trend for that matter, probably isn't for you. And, stick to the OGs that we really have a ton of data for, right? Your sunscreen, your retinol or your retinoid, your moisturizer, vitamin C, maybe if you want to level up a little bit.
Mhm.
But those are like my basic 3 or 4 things that when people are like, just give it to me straight. I want the basic. I want the bare necessities, because those are the ones we have mountains of data for. And all this other stuff, sure, it may work for some people. It may make some things worse, like you said, Jessica. So um, I think it depends on kind of what you're looking for. But back to the specifics that you were asking about, the centella is botanical extract, and it's been used for a long time in Eastern medicine. And it sort of has anti-inflammatory, antioxidant benefits. It's also used orally in Eastern medicine for, anti-anxiety, anti-epileptic, and antidepressant benefits, which is interesting to me as I was reading about it. But it's in some bigger brand name products that you may have heard of. Cicaplast, which is a La Roche-Posay product, great for restoring barrier. And Aven makes one called Sickle Fate. But I think sort of the 2 main ingredients in those products that really speak to the benefits that they provide is the centella extract and then zinc oxide. Zinc oxide we use on butt paste for diaper rashes. It's a great barrier. And, I think those 2 ingredients coupled together really help kind of restore that barrier. So I recommend Cicaplast a lot for my patients who, maybe just starting a retinoid and are having a ton of peeling, and we're sort of battling that, that push and pull with the retinoid dermatitis versus the acne. So using that a couple of times a week in place of their retinoid can be helpful, just to kind of make sure their barrier is staying intact.
Yeah, and I did see that La Roche-Posay ingredient or product come up quite a bit too on some of those TikToks that people are throwing in. And I think the rice water was kind of the same. It's the antioxidant, anti-inflammatory properties. It's been around for a long time, but like you said, just not a lot of data to really tell us if it works or not.
Right. Fun to try though. I will admit I just recently got sucked into, one of my dermatologist friends actually sent this to me, 2 Korean uh toners. One of them is centella. The other is sort of a prebiotic. It's like lactobacillus ferment extract. And she said, don't ask me what it does, but I swear my skin is so much better. So I've been using it. And I love it also. Again, it's very hand wavy. I'm not so sure what it's doing, but I seem to like it. But again, it's like what you find joy in. If you like going with it, go for it.
And I think when we talk about these TikTok trends, we're seeing, like we said, younger and younger people taking care of their skin and paying attention to it and having fun with it and having a passion for it, which I think is great.
Yeah.
But this is also the same age range that we do start to develop more skin concerns, right? In that teenage age range where we are really getting those, first bigger acne pimples, or we're starting to really worry about these things. And they start saying, okay, well, I need this wash or this skincare regimen. But let's target for them, since they're the ones that are asking mom and dad for the Sephora gift cards and all those things for Christmas, because that's what they want these days. Instead, is how to build their skincare routine. What do they actually need to be doing? How does a teenager, who's worried about skin concerns, how do they build a skincare regimen and when their skin starts misbehaving?
Totally. This is such a huge issue for me in my clinic. I mean, I see these really young girls come in and I'm telling you, they can tell me like a 10-step routine. And, I have no street cred if I can't, talk to them about these TikTok trends. So, but anyway, I'm, like we talked about, keeping things simple is key here, because a lot of times just the more complex the routine, the more irritants and fragrances and all of these things that are worsening the barrier and contributing to the acne is just in the end just making things so much worse. And so the first step is, just establishing a good routine of personal hygiene and care, right? Starting to wash your face without having your mom, force you to, every day. And with just a really gentle cleanser. We don't need alpha hydroxy acids, and we don't need, all of these ingredients that, older, that are targeted towards more older. Okay, that's us, but
Mature
Mature
skin.
skin.
they don't need all of these added ingredients, but just, a simple, gentle cleanser every day can be so helpful. Making sure they're washing their hair at least a few times a week. Every other day, I try to get them at least every other day. For boys, every day, because the oil on our scalp then sits on our hair and then, is on touching our face all day long, especially these boys with the TikTok hair. Okay. Firm, and it's like all
Down here.
across the forehead. And, mom brings the the teenage boy in, and the first thing I do is I lift up their bangs, and it's just like blackhead city. And I'm like, how often are you washing your hair? Well, they can't very much because the perm. It's a whole thing. But anyway, so washing your hair, every day to every other day is a huge component of this. And then your sunscreen and your moisturizer. I think starting just with that is a major win. But then if we're still battling with, the blackheads and starting to get some acne, adding in one active ingredient at a time can be really helpful. And typically the first one that I recommend is either, a mild salicylic acid based cleanser or a benzoyl peroxide based cleanser. If it's mostly just blackheads, I start with the sal acid. If it's more inflammatory and they're starting to get whiteheads and it's, big red inflamed pimples, then I usually recommend the benzoyl peroxide. But starting with that, and again, letting your skin cycle through that, and giving it at least 6 to 8 weeks. And if we're not, improving then I think bumping up to a really mild retinoid over the counter, like adapalene, can be helpful. But I think that's when you should start enlisting the help of a dermatologist or even your pediatrician. Just so I think the main thing with acne treatment with kids is just the counseling of the side effects, right? And what to expect and all of that. But trying to do it at home on your own, learning through TikTok, often doesn't lead to much success.
Absolutely. And just briefly, our last point that we'll talk about, only because I see so much of it in all of these stores. And I think it can be a little bit misleading. Can you just kind of talk about when people put out their clean beauty, because that seems to be something that people are really into now, especially young people. Is that really helpful, or is it really just marketing?
Yeah, this is frustrating. I think, it's frustrating because it is marketing, but it's also sort of fear mongering and sort of getting us at our core, what we do want, right? I don't think anybody's wrong for wanting something to be clean or to be non-toxic or, all of these things. It sounds great. I get into this with parents of my patients all the time too, with babies and their, eczema skincare, and they want natural, they want organic, they want plant-based, which I didn't know soaps could not be plant-based. I don't know, is it meat in there? I don't know. It's very confusing. But I think they're really cashing in on this because
Predatory behavior, right? That's what I think I always call it, predatory behavior on people who just want the best for their family, themselves.
Yes, exactly. And really, so I get questions a lot about, the environmental working group or the Yucca app. Again, just people wanting a source for what can I trust? What can I believe in? And sadly, I don't think either of these apps are what you can believe in. And, they are funded majorly by the organic sort of lobby. And, companies and brands pay big bucks to get those labels, right? Because they know it works. But that doesn't seem to me like something you should be able to buy, right? And if you cross-reference, so if I go into the environmental working group or the Yucca app and I put in Vaseline, like my absolute favorite product ever, and it says it's horrible and toxic, right? Which is crazy. But then if I put in Aveeno baby wash, which is one of my nemesis, or Dreft or something like that, that has tons and tons of fragrance, but the fragrance is natural botanical oils, right? It's a 10 out of 10, right? And yet my patients come in with horrible rashes after using it. So, and then I think there have been some studies too that surveyed toxicologists, and there's some great studies there's a nice editorial in our derm journal, the JAD, in these clean products, often are terribly allergenic and, can lead to a lot of rashes. And the toxicologists themselves don't even agree with what they're, touting as toxic. And so I think it's just frustrating. It's a frustrating landscape because I don't blame people for wanting that. It's just not a great source.
I think that is a fantastic thing for us to close the episode on, though, is because, again, that predatory behavior is the whole reason that Cari and I got into this whole let's make a podcast thing, was to try to combat some of that predatory behavior, misinformation. We're not selling anybody anything when we sit here and interview all these amazing specialists who come on our podcast. We are literally trying to get this information that we as doctors are really privileged to oftentimes get because we got it through our education. We get it through talking to other specialists and firsthand experience with patients and reading the appropriate journals. Well, normal people, everyday people don't have access to all these same resources. And so we are so thankful to have someone like you, Dr. Massey, on who can really talk about these TikTok trends and really bring it home for us. I'm sure you have a lot of street cred with your patients. You have a lot for us too, based on your education and experience. But now we get to also, say, hey, personally, I get to take some of these home and apply them, but also with my own patients. So that just concludes another fantastic episode of the Med Edit podcast. Thank you again for being a guest, Dr. Massey. We would love to have you back at another point soon. We have a lot more I'm sure we could talk about.
Thank you guys so much for having me. This was so much fun. I love talking skincare anytime. Make up your list on all the TikTok trends. We can go through them.
I love it.
Awesome. I'll get back to it. I'll get back to my For You page. I'm sure in the time we've been here, something new is now popped up that we're going to have to go research.
All of our devices in the room are listening to what we're talking about. And so they're all going to be ready to go. When
Big Brother has got those ads ready to go on all of our social media. And I've honestly learned a few things that I might pick up now that have some evidence behind them. But as a reminder, don't forget to check out the show notes in order to claim your CME credit. Thank you all for listening. Please like, subscribe, and share the episode. Let us know what other topics you're interested in through our Instagram, and stay tuned for the next episode.